Is this how our COVID warriors must be treated? The ongoing protest by the resident doctors, especially in the national capital. There seems to be no hope for the doctor center logjam to end anytime soon. The resident doctors have been protesting for over a month now, demanding expedition of NEET PG counselling. Today, the health minister met the protesting doctors, but the meeting remained inconclusive. Patients. Dr. Anuj Agrawal,
whatever he told us today, it was similar to the assurance that he gave us on the previous meeting that was held on 8th of December, and it was again same as the previous meetings. Earlier, he told us that the report that has to be submitted is ready. That was last week, the meeting that was held on 8th of December. He told that the report is ready and it is going to be submitted within 2-3 days. But nothing happened. And in the previous meeting, he told that they will get the case mentioned in the Supreme Court for speedy hearing, for early hearing. But nothing happened. And today also, he said the same thing, that the report is almost ready and they will mention it and they will submit it within 2 to 3 days. So whatever this Honorable Health Minister has been saying to us, that is actually slightly beyond our belief now, because he has been telling us the same thing from almost a month now. And we have been requesting him just to address the crowd, because he is the leader of masses, he is the leader of common public, and the doctors are a part of Indian citizens only. So even he is not ready to address the common public, and even he is not able to, not agreeing to put a simple tweet. Second thing I want to address is regarding Dr. Jailal's comment that doctor strike is not a good option. I agree to you, sir, but strike is the last resort that we were left with. We have been writing letters to ministry, to the judiciary also since a long time, but nothing came from their side. There was no communication at all. And regarding the protest, we started it from 27 November. It was 1 month back, and we, prior every action, we gave a letter of intimation to all the authorities at least 48 hours prior to that. And we first boycotted OPD services only, but consultants were working. Then we boycotted routine services, but consultants are working. And now we have been forced to boycott emergencies also. And in between, based on the assurances, in good belief, we joined our services back. But from the other side, nothing has been coming. We have not able to see any concrete action coming. So this is the last option that has been left to us, because we are feeling that we are completely being ignored and we are just unheard. And the third thing that I want to reply, you are saying that the doctors uses taxpayers' money for their education. I would like to differ in that, sir, because a doctor in Government Hospital of India, he provides services more than what he is paid for. The rule as per the government is to work for 48 hours in a week, but an Indian doctor works for almost 80 to 100 hours in a week, and they have to work for 36 hours to 48 hours continuously. That condition is not human condition, sir. You can't see any other professional working like that. And after that, you expect that they will provide quality care to the patient. That is, I think that is beyond any logic, sir, beyond any rationality. And whatever the doctors provide, that is beyond what they are being paid for. And what about the salary that you would have, that the government would have provided to the doctors who have been employed from May? That amount of taxpayers' money that should have been given to doctors who had been recruited till now, that is government. So who is using taxpayers' money and who is not? I think common people are able to understand, sir. That is beyond any question, sir. That is undoubtable.